Most men beyond their 60s often assume that a prostate checkup is a surefire way to stay healthy. But the reality is a bit more nuanced. Some of the very tests you've been told are important might actually cause more problems than they solve at this stage of your life. Instead of protecting you, they could lead to unnecessary procedures, create needless anxiety, and even limit your independence. This idea that more tests automatically equal better health is not only outdated, it can actually diminish the quality of life you're working to maintain. I'm Dr. Edward Langley, and for over 30 years, I've been a urologist specializing in men's health, treating thousands of men just like you. I've certainly seen the good that prostate exams can do. However, I've also seen how the wrong test at the wrong time can really throw a man off course. My goal is to share honest information with you, not just repeat what's always been done, and to offer you the benefit of my experience. Here's the thing, the same checkups that gave you peace of mind in your 40s and 50s can actually become risky as you get into your 60s and 70s. Something that was once a lifesaver could now expose you to infections, surgeries you don't need, or a long recovery from complications that could have been avoided. So today, I want to talk about 5 specific prostate checkups that men over 60 should really think twice about. We'll discuss which ones have hidden risks, why even doctors sometimes avoid them, and what safer options are available so you can make informed choices. And please stick around because the third checkup on this list is one that most men never even question. Yet, it's a test that many doctors quietly refuse for themselves. Now, before we get started, if you haven't already, please subscribe to my channel and hit the notification bell. That way, you won't miss any of my important health updates specifically for men over 60. And if you find this information helpful, please type yes in the comments. If not, type no, and tell me how I can make these videos more useful for you. Let's jump right into the first checkup you should be cautious about after 60. It's something you've probably heard of, maybe even had done many times, the PSA blood test. It used to be considered essential, but as the years go by, it can quietly become more harmful than helpful. First, let's talk about the overuse of the PSA blood test. For years, the PSA blood test has been promoted as a key tool for protecting a man's prostate health. It seems simple enough, a quick blood draw, a number on a chart, and you feel confident that cancer has either been caught early or ruled out altogether. Many men over 60 have come to rely on this test. Some even expect it at their annual checkups, almost demand it, because they've been told it's the right thing to do. I understand that feeling. I too encourage my patients to have their PSA checked regularly, believing it was the best way to catch problems early. But here's something the textbooks don't always prepare you for. The PSA test isn't perfect. It's a number that can fluctuate for many reasons, and cancer is just one of them. An infection can cause it to rise. An enlarged prostate, which is common as men age, can also increase it. Even sexual activity within a day or two of the test can affect the result. When you're younger, doctors are often more willing to investigate these false alarms. But after 60, chasing a slightly elevated number can have consequences that are far more damaging than the risk you were trying to avoid. I remember a patient, Robert, who came to see me when he was 68. He lived a healthy life, exercised, ate well, and was enjoying retirement with his wife. His PSA came back slightly above the normal range. Nothing alarming, but enough to warrant a closer look. He had a biopsy, which led to complications. Within days, he was in the hospital battling an infection from the procedure. He spent weeks recovering, and his confidence in his health was shaken. And what did the biopsy find? A tiny cluster of cells that posed no real threat to his life expectancy. Robert could have lived for many more years without ever knowing it was there. But the fear of cancer and the resulting medical interventions robbed him of his peace of mind and temporarily his independence. This is what I mean when I say the PSA test can quietly let older men down. At best, it offers reassurance. At worst, it pulls you into a cycle of repeat blood tests, scans, biopsies, and difficult decisions about treatments you may never have needed. And treatments for prostate cancer aren't without their own risks. Surgery and radiation, especially after 60, can often lead to side effects like urinary incontinence or sexual dysfunction. These are significant sacrifices. They affect your daily life, your self-image, and your intimacy with your partner. The toughest part is that these choices often arise not because you had troubling symptoms, but because a number on a blood test suggested something might be wrong. That's the paradox. A test designed to protect your health can end up harming it. I've talked to many men who said the worst part wasn't even the medical procedures themselves. It was the anxiety. Every phone call from the clinic, every waiting period for results, every mention of the word cancer, felt heavier than the condition itself. Worry became their constant companion, even though their bodies were otherwise strong and healthy. Does this mean no one should ever have a PSA test after 60? Not necessarily. There are situations where it can still provide valuable information. If you have a strong family history of prostate cancer, or if you're experiencing bothersome urinary symptoms, your doctor might recommend it, and for good reason. But the key takeaway is this: it should never be automatic. It should be a carefully considered decision, with a full understanding of the potential risks. Too many men go into it blindly, assuming it's just routine, only to find themselves caught in a series of interventions that offer little benefit at their age. As a doctor, my advice is this: after 60, have an open conversation with your doctor about whether PSA testing is right for you. Don't let habit or fear make the decision. Ask the tough questions. If the test is positive, what's the next step? How will it change my treatment plan? Will it actually extend my life, or will it just add stress? These aren't easy conversations, but they're crucial if you want to protect both your health and your quality of life. I've seen men who decided to stop routine PSA testing in their 60s and 70s. Many of them described it as liberating. Instead of living from one test result to the next, they focused on enjoying time with family, staying independent, and taking care of their bodies through exercise and healthy habits. They weren't being reckless. They simply realized that at a certain point, quality of life matters more than chasing numbers on a chart. The truth is, medicine has changed. Organizations like the U.S. Preventive Services Task Force and the American Urological Association no longer recommend routine PSA screening for men over 70, and they advise caution even after 60. Why? Because the evidence shows that the risks often outweigh the benefits. It takes courage to accept that less can be more, but as we get older, wisdom often lies in restraint. So, before you roll up your sleeve for another blood draw, take a moment. Ask yourself if that needle is giving you peace of mind or setting you on a path you might later regret. It's not about ignoring your health. It's about respecting it and respecting the years you've earned. And if the PSA test has risks that most men don't realize, just wait until you hear about the next checkup. It seems even more routine, almost harmless. Yet, it can cause fear, discomfort, and unnecessary treatments in ways you might not expect. Second, let's talk about the digital rectal exam, or DRE, when it's done without a clear need. For generations, the digital rectal exam, that dreaded finger test, has almost been a rite of passage for men as they get older. Many of my patients still come into my office bracing themselves for it, assuming it's just part of being a man over 60. They take a deep breath, grit their teeth, and tell themselves it's necessary. I know that look in their eyes when I put on the glove. It's a mix of embarrassment, resignation, and a quiet hope that I'll say everything feels fine. For many years, we doctors believed this exam was essential. I performed it countless times early in my career, sure that I was protecting my patients. But experience and research have taught me a more complex truth. After 60, especially if you don't have any symptoms, this exam often causes more harm than good. The first harm is emotional. Let's be honest, no man looks forward to a rectal exam. It takes away your dignity in a way that can linger long after the appointment. Some men nervously laugh it off. Others sit in silence, staring at the floor. A few have told me later that the anxiety before the exam was worse than the exam itself. And here's the cruel part. In many cases, all that discomfort leads nowhere. The prostate can feel slightly firm or irregular for completely harmless reasons, and that can trigger a series of tests, blood draws, biopsies, and scans that carry risks far greater than the exam itself. I've seen men endure months of stress, convinced they had cancer, only to find out it was nothing at all. One story I'll never forget is James, a retired school teacher in his early 70s. Every year, he dutifully scheduled his physical, and every year, he dreaded that one moment when the doctor would perform the rectal exam. One visit, his doctor thought he felt a suspicious nodule. That single impression led to 3 separate biopsies over the next year. Each one was negative. Each one left James sore, anxious, and frustrated. He told me later that those months were some of the darkest of his life, not because of a disease, but because of uncertainty and fear. He had no urinary symptoms, no troubling signs. And yet, he spent a year convinced he was living under the shadow of prostate cancer. What did that exam give him? Nothing but worry. The second harm is physical. While the exam itself is quick and generally safe, it's what comes after that often proves harmful. The human prostate changes with age. It becomes larger, more textured, sometimes irregular. These are natural, harmless variations. But to a probing finger, they can feel suspicious. A false alarm sets off a chain reaction. Suddenly, a man who walked in symptom-free finds himself in a medical maze of procedures. He's poked, scanned, and sampled, not because he was sick, but because an outdated habit insisted he should be checked. Too often, the outcome is unnecessary pain or complications that were entirely avoidable. The third harm is subtle but profound: the erosion of trust. When men go through unnecessary procedures triggered by rectal exams, they start to lose faith in the medical system. They question their doctors, or worse, they avoid care altogether. I've spoken with patients who refused to come back for years because they felt humiliated or traumatized by an exam that, in hindsight, offered no real benefit. And this breaks my heart because those same men might ignore real symptoms when they eventually arise, all because they no longer believe the system is on their side. So, should no man over 60 ever have a digital rectal exam? Not necessarily. There are times when it matters. If you have persistent urinary problems, difficulty starting your stream, pain when you urinate, blood in your urine, or unexplained pelvic discomfort, then yes, a rectal exam can help identify what's happening. If your PSA is rising and your doctor needs more information, then perhaps it has a place. But if you're symptom-free, if your history is stable, then submitting yourself to this exam year after year isn't doing you any favors. It might be serving tradition, it might be serving habit, but it's not serving your health. As a doctor, I've become more cautious with this test. I no longer insist on it just because a man has reached a certain age. Instead, I sit down with my patients, and we talk. We weigh the value. We discuss whether it will truly change their care. And more often than not, my patients feel relieved when I tell them the truth, that declining this exam isn't reckless, it's wise, it's an act of self-respect. So, if you're over 60 and your doctor automatically reaches for the glove, take a moment. Ask why. Ask what difference it will make. Ask what the plan will be if he feels something irregular. Don't give up your dignity for a test that might do nothing but cause fear. Medicine should change as we age, and wisdom means knowing when to say no. And if you thought the rectal exam was uncomfortable, just wait until we talk about the next checkup. It's far more invasive, carries risks you may not have been warned about, and is a procedure many doctors secretly avoid for themselves, even while recommending it to their patients. Third, let's talk about colonoscopies that are done too frequently. Colonoscopy is one of those words that makes men over 60 instinctively tense up. I've had patients chuckle nervously about it, as if joking could make the thought less daunting. Others simply shake their heads and say, "Doc, do I really need to go through that again?" And I understand them. I remember my very first colonoscopy training during residency, how meticulous the procedure was, how uncomfortable the patients looked afterward, and how relieved they felt when it was over. Back then, it seemed like the gold standard for preventing colon cancer, and in many ways, it still is. But here's a truth that doesn't get said often enough: too many men are having colonoscopies more frequently than they actually need. And it's not only unnecessary, it can be harmful. When you're over 60, your doctor may have already encouraged you to get your first or second colonoscopy. That's a good idea because colon cancer is most common in older adults. A properly timed colonoscopy can detect precancerous polyps early, and removing them can literally save your life. But the problem arises when colonoscopies are repeated too often without a clear reason. I've met men who were urged to repeat the test every 3 years, even though their results were clear, they had no family history, and they had no symptoms. Imagine going through the preparation, the strict fasting, the harsh laxatives, the long night in the bathroom, and then undergoing sedation and a procedure that carries real risks, all when it might not be medically necessary. Those risks are not trivial. Colonoscopies can cause bleeding, perforations, or complications from anesthesia. I once had a patient, Robert, a 68-year-old grandfather who was in excellent health. His first colonoscopy came back clear, yet he was told to repeat it just 3 years later. Reluctantly, he went ahead. During the procedure, a small perforation occurred. He ended up in the hospital undergoing surgery and spent weeks recovering. His life wasn't improved by that second colonoscopy, it was derailed by it. Robert later told me, "Doc, I wish I had asked more questions. I didn't know I could have waited 10 years. And he was right. The official guidelines in the United States are very clear. If your colonoscopy shows no polyps and you don't have a strong family history or risk factors, you usually don't need another one for 10 years. 10 years. That means if you have one at 60, you might not need another until you're 70. Yet time and again, I see men pressured into doing them more often, sometimes by well-meaning doctors playing it safe, other times by a system that rewards more procedures. Either way, the man who suffers is the patient. He endures the anxiety, the discomfort, and sometimes the complications, all for little to no gain. There's also a psychological cost. I've listened to men describe the dread they feel leading up to a colonoscopy. The week before, they change their diet, rearrange their schedules, and worry about what might be found. Even when the results are normal, the stress leading up to the procedure takes a toll. And if it's being repeated unnecessarily, that toll adds up over time. One patient once told me that he almost skipped his granddaughter's birthday party because the prep day for his colonoscopy overlapped. He looked down, shaking his head, and said, "I missed out on memories for a test I didn't even need yet." Those are the hidden costs no one talks about. Of course, I don't want to give the impression that colonoscopies aren't important. They are. Colon cancer is one of the deadliest cancers, and timely screening saves lives, but balance is key. The goal should be to protect you, not to put you through unnecessary risks. As a doctor, I now approach colonoscopy with more nuance. I look at each man's history, his family background, his overall health, and the results of his previous screenings. I've had very rewarding conversations where I told a man, "You don't need another colonoscopy for almost a decade." The relief on his face said it all. He felt respected, heard, and reassured that medicine could be tailored to him, not just to a rulebook. So, if you're over 60 and someone tells you it's time for another colonoscopy, pause and ask, when was my last one? What did it show? What are my real risk factors? You may find the answer isn't every few years, but rather not until the next decade. Protect your health, but also protect your peace of mind. Because here's a sobering truth. If colonoscopies are sometimes done too often, the next test we're about to discuss has the opposite problem. It's often skipped when it's needed most, and ignoring it can have deadly consequences that every man over 60 needs to be aware of. Fourth, let's talk about ignoring the PSA test. I'll never forget the day an older gentleman sat across from me, his hands trembling just slightly as he asked, "Doc, do I really need that PSA test? I feel fine." His question struck me because I've heard it countless times, especially from men over 60 who believe that if they don't feel sick, there's nothing wrong. And while I understand that instinct, we all want to believe that no symptoms means no danger. The truth is that prostate cancer is one of those silent threats that can develop quietly without any warning signs until it's dangerously advanced. Ignoring the PSA test is one of the most common mistakes I see men make, and it's a choice that can change the course of their lives. The PSA test is simple. It's just a blood test, no more complicated than checking your cholesterol or blood sugar. Yet, it has the power to reveal early changes in the prostate before symptoms ever appear. That's the key, early detection. I've treated men who had no pain, no urinary trouble, no visible signs at all. Yet, their PSA test flagged something abnormal. A biopsy confirmed cancer, caught early enough to treat and cure. One man in his mid-60s once told me, "Doc, I would never have known. I owe my life to that little test." Hearing that reminded me just how powerful prevention can be. But here's the problem. Too many men avoid or delay the PSA test, some because they're afraid of bad news, others because they've read controversial headlines claiming it's unnecessary. And yes, it's true that the PSA test isn't perfect. It can sometimes flag issues that aren't cancer, leading to anxiety or additional tests. But the alternative, skipping it altogether, carries a much heavier risk. When prostate cancer is discovered late, it's often spread beyond the prostate, making treatment more difficult and survival less likely. I've had the heartbreaking responsibility of telling men that their cancer was advanced, and their eyes always carry the same regret, "I should have checked sooner." When I talk with men over 60, I like to be honest about the pros and cons. No test is perfect, but the question I ask them is simple. Would you rather know now, while something can be done, or find out later, when options are fewer and harder? Most men, after a quiet pause, say they'd rather know. That's the moment I see the fear shift into empowerment. They realize the PSA test isn't a burden, it's a safeguard, a way of taking control of their health instead of leaving it to chance. I've also noticed something else. The men who do take the test regularly often carry a kind of peace of mind. They tell me, "At least I know, Doc," and that reassurance helps them live more fully without the nagging question in the back of their minds. Compare that to the men who avoid it, who live with uncertainty, and often come in only when symptoms force them to. By then, the battle is much harder. It breaks my heart when I think about how many lives could be saved if more men treated the PSA test as a routine part of aging, the same way they treat blood pressure checks or cholesterol screenings. Prostate cancer is the second leading cause of cancer death in American men. Yet, when caught early, it's one of the most treatable. That's the paradox. It's both one of the deadliest and one of the most survivable, depending entirely on timing. So, if you're over 60 and you've been putting off the PSA test, I urge you to reconsider. Talk with your doctor, weigh the benefits and risks, but don't ignore it altogether. Your health, your future, your time with your family, it's worth the few minutes it takes to draw blood. Imagine the difference it could make, not just for you, but for the people who love you. And here's something even more surprising. While many men fear over-testing, what often gets overlooked are the silent risks hidden in the very medications prescribed to them. That's right, some of the pills you might be taking every day, the ones meant to help, could actually be putting your prostate at greater risk. Fifth, let's talk about overlooking medication side effects. Over the years, I've sat with many men in their 60s and 70s who came to me frustrated. They weren't just dealing with prostate issues, they were also battling side effects from the very medications prescribed to help them. I remember one patient in particular, a retired teacher who told me, "Doc, I thought these pills were supposed to make me better, but now I feel worse." His words stayed with me because it's a story I've heard too many times. The truth is, while medications can be life-saving, they often carry hidden consequences, especially for men over 60. And too often, those consequences directly affect the prostate. Blood pressure pills, for example, are some of the most commonly prescribed medications for older adults. While they can protect the heart, certain types, like beta blockers or diuretics, can quietly contribute to urinary problems, making men feel like they need to rush to the bathroom more often. Other drugs, like antihistamines for allergies or antidepressants, may relax or tighten muscles around the bladder, creating difficulty with urination. Imagine the confusion for a man who doesn't realize his discomfort is being triggered not by age alone, but by the medicine he's faithfully taking every morning. Then there are medications with even more direct consequences. Some drugs used for hair loss or prostate enlargement itself, like finasteride, can lower PSA levels artificially. On the surface, this might seem like a good thing, but in reality, it can mask early signs of prostate cancer. I've seen men who thought their numbers looked fine, only to later discover their cancer had gone unnoticed. It's a cruel irony, trying to protect the prostate only to create a blind spot in monitoring it. And let's not forget about painkillers or hormone treatments. Long-term use of certain opioids can lower testosterone, weakening sexual health and further complicating prostate function. Steroid medications, often prescribed for inflammation, can disrupt hormone balance as well. Each pill, each prescription carries a story of both help and harm, and that's why awareness is so critical. I often encourage men to bring every single medication bottle to their appointments. We lay them all out on the desk: blood pressure pills, allergy meds, sleep aids, supplements, and we go through them one by one. More often than not, we discover at least one that may be contributing to prostate or urinary problems. And the look on a man's face when he realizes the solution may be as simple as adjusting a dose or switching a prescription, it's a mix of relief and frustration. Relief that there's an answer, frustration that no one told him sooner. What pains me most is how many men suffer in silence, assuming their struggles are just part of getting older. They don't realize the connection between their medicine cabinet and their prostate health. I once had a patient who avoided social events because he was embarrassed by how often he had to excuse himself to use the bathroom. After reviewing his medications, we changed one prescription, and within weeks, his life was different. He came back smiling, telling me he'd gone to his granddaughter's recital without a single trip to the restroom. That's the power of knowledge. Of course, I'm not suggesting anyone stop taking prescribed medications on their own. That can be dangerous. But what I am urging is this: be proactive. Ask questions. Sit with your doctor and go through every medication carefully. Say, is this helping my heart but hurting my prostate? Is there an alternative that can protect both? Those conversations are not only reasonable, they're necessary. As men, especially past 60, it's easy to feel like life is being managed by a series of pills, but your health shouldn't feel like a trap. You deserve to know what's helping you and what might be quietly harming you, and you deserve to have choices. When it comes to your prostate, ignoring the side effects of medications is like leaving a window open in the middle of a storm. The damage might not be immediate, but over time, it adds up. That's why awareness is your greatest defense. If you're listening to this and realizing you've never had that conversation with your doctor, maybe now is the time. Because sometimes protecting your prostate doesn't mean adding something new, it means questioning what's already there. And here's the thought I want to leave you with as we wrap up. While medications, lifestyle, and screenings are all important pieces of the puzzle, there's one final powerful truth about prostate health that ties everything together, a truth that every man over 60 needs to hear before it's too late. As I think about everything we've talked about, I can't help but think about the many men I've met in my practice who had the same worries you might have right now. They worried about frequent trips to the bathroom, about sleepless nights, about losing a sense of control over their own bodies. They worried that getting older meant slowly losing the quality of life they once knew. But here's what I've learned from decades of working with men just like you: it doesn't have to be that way. We talked about how skipping regular checkups can turn a small issue into a big problem, and how something as simple as a screening could save not only your prostate but also your peace of mind. We looked at how diet and the small daily choices, what you put on your plate, can either cause inflammation or protect you from it. We looked at lifestyle factors like exercise and managing stress, those daily habits that either quietly strengthen your health or slowly chip away at it. We found out how ignoring urinary symptoms is like ignoring the early warning signs of a fire in your home, a mistake that too many men only realize when it's far too late. And we talked about medications, those little pills that can be both friend and foe, and why understanding their effects is just as important as taking them. Each of these points comes back to one simple but powerful truth: awareness is power. The more you understand your body, your risks, and your choices, the better prepared you are to protect your health and live fully. I'm saying this not as a doctor lecturing from a distance, but as someone who has seen the difference these changes can make. I've seen men get back their confidence, return to the things they love to do, and feel good about their health again. And that's what I want for you. So, if there's one thing you remember from our conversation, let it be this: you are not helpless. Prostate health isn't something that just disappears as you age. It's something you can nurture, protect, and keep strong if you're willing to take the steps. Don't wait for the problem to become too big. Don't accept discomfort or worry as your new normal. Start now, because every decision you make today affects the life you'll live tomorrow. And believe me, the peace, freedom, and energy you'll gain are worth every bit of effort.